Welcome, dear friends, once again in the teleconference session in the program of certificate program in healthcare waste management. This is a very important program for this all the healthcare personnel. This program is not only offering in India but outside India also. Today we are going to discuss basically two topics. Our first sessions, like 45-minute session, will be on the infection control precaution in various areas within the hospital healthcare facilities, and second topic will be environmental practice for healthcare facilities. We have experts for these two topics, and extremely left says Dr. Sumati. Welcome, ma'am. She is senior microbiologist from Bhagwan Mahavir Medical College and Safdarjung Hospital, New Delhi, and she is also program in charge of that certificate program in healthcare waste management. And just next to me, left side, she is Dr. Mega. She is experts in the healthcare waste management system. And first topic will be discussing Dr. Sumati, and I would like to request Dr. Sumati to discuss these various infection control precautions in different areas of the healthcare facilities. Dr. Sumati, please.
Thank you, Dr. Bipla, and welcome you viewers. And today I have been allotted a very important topic, the topic of infection control precautions in various areas within the healthcare facility. And this topic is very much related to healthcare waste management. So it's hoped that all of you will be benefited by this session. So before beginning and going into the subject proper, let us first clarify a few definitions and know a few words that are frequently used in this regard. Firstly, hospital-acquired infections. This is a very important term that is often used these days, also called as nosocomial infections. And now the newer term, healthcare-associated infections, is also used synonymously to this. What are the hospital-acquired infections? These are clinically recognizable microbiological diseases affecting either the patient or the hospital staff, that is the healthcare worker. Now, when we say microbiological diseases, they could be diseases caused by any of the microorganisms, that is the bacteria, virus, parasites or fungi. And in patients, these diseases occur as a consequence of their being admitted to the hospital or attending for treatment. That means the patient comes to the hospital with one infection and then he carries back another infection as a result of being in the hospital. That is hospital-acquired infection. And in the healthcare staff, that is in the healthcare worker or hospital staff, these infections are a consequence of their work. Whether the symptoms appear while the patient is within the hospital or after discharge, they are still classified as hospital-acquired infections. Now, what are the types of nosocomial infections or hospital-acquired infections? In patients, they could present as urinary tract infections, lower respiratory tract infections, surgical site wound infections, or as blood-borne infections. And in hospital staff, they could be gastrointestinal infections, which are more commonly presenting as diarrheal diseases, or they could be blood-borne infections or respiratory tract infections. Now, what are the important routes of these nosocomial infections, routes of transmission, that is? They can be transmitted by direct contact with patients or with the infected material, or by feco-oral route, the airborne route, droplet infection, For example, tuberculosis is transmitted by the droplet infection, or even by the bloodborne route. That can also be a mode of transmission. Here again the examples are the hepatitis C virus infection, hepatitis B virus infection, and HIV, that is the human immunodeficiency virus. Now the risk of transmission of these bloodborne infections in the healthcare setting could be three-way. It's either from the patient to the healthcare worker, or healthcare worker to the patient, or from one patient to another. Now, the patient to healthcare worker, this is quite a common occurrence. And how does this happen? This could be by parenteral exposure, that is by giving injections or during giving of the drips, or by mucous membrane contact, or non-intact skin contact. And healthcare worker to patient, this way also the infections can occur. And this happens when, say, the healthcare worker is having some infection like the hepatitis B virus infection, or if he is HIV positive, the chance of transmitting to the patient is there. And infections that are transmitted from one patient to another, this also can happen as a result of using a common equipment which has not been sterilized or disinfected properly, or due to procedures which are performed by aseptic techniques. So these are all the modes by which the infections can be transmitted in any of these, from patient to patient, or patient to the healthcare worker, or from the healthcare worker to the patient. The risk of transmission of bloodborne viruses. Just for example, I have picked on the HIV virus, the hepatitis B and C viruses. For comparison, we have the figures here. The chance or the risk of HIV virus being transmitted in a percutaneous exposure is about 0.3%, while for the mucocutaneous exposure it's about 0.05%. Similarly, for hepatitis B virus, the percutaneous exposure rate is about 1.9 to 40%. And hepatitis C virus, the percutaneous exposure rates are about 3 to 10%. So from these statistics, it is evident that among the three diseases mentioned here, hepatitis B virus, the risk of transmission is highest. Yet we tend to concentrate more on the HIV transmission. This is because there is no available effective vaccine for HIV infection, that is for the AIDS disease, while hepatitis B has got an effective vaccine. So we tend to lay more stress on HIV infection. Although hepatitis B should be given as much importance because the risk of transmission is pretty high in the healthcare setup.
And what about hepatitis C?
Hepatitis C, it's not as high as for hepatitis B and HIV, but it doesn't have a vaccine again. But there are treatment modalities for hepatitis C, unlike in HIV, where prevention is the best cure.
But Dr. Sumati, the main question is, is there any particular disease where the frequency is the most common? Is it only through, is it only through parenteral route, or it may be some kind of like airborne disease also?
Yeah, as I mentioned, all these.
What are the disease burden because of all this acquired infection and nosocomial infection? Can you give some lights on this issue, because we are having huge patients in the hospital and lots of healthcare. So what could be the disease burden because of acquired disease as well as nosocomial? Yeah,
here I must separate the two entities. The one is the community acquired infections, or the CAI as they are called, and the other issue is of hospital acquired infections. So the community acquired infections are different. That could be due to various factors, and it depends on the endemicity, the geographic region, and lifestyles, customs, and so many other issues. But the hospital acquired infections are by and large preventable. That's why we have to lay more stress on this, because when the patient comes with some problem or disease, he shouldn't end up getting some other problem from the hospital and taking it back. So that's the basic aspect we have to look into. And here, hospital acquired infections can be transmitted by various routes, as I mentioned. So the burden is when you have to tackle them, according to, at every stage we have to take the precautions. Say the waste management, taking precautions and standard precautions. Actually, one of my latest slides will address this issue of standard precautions. So whether it's blood-borne infections or that is by the parenteral route or fecal-oral route, whatever the route may be, we have to tackle them accordingly. That is accordingly the precautions will have to be taken. So I think
Yes,
a little
ma'am.
later during
Later
the
we
thing,
can definitely.
maybe it will become clearer to you.
Sure, ma'am.
So what are the common organisms that are involved in nosocomial infections or healthcare associated infections? They are bacteria, viruses, protozoa and fungi. Among the bacteria in patients, the common bacteria include Klebsiella, Pseudomonas, Staphylococcus aureus, Proteus and Acinetobacter. While in staff, the common organisms include Salmonella, Shigella, Klebsiella and Staphylococcus aureus. And viruses like HIV, the hepatitis B and C viruses. Protozoa include Entamoeba histolytica and Giardia lamblia commonly. Both of these cause diarrhea. And among the fungi, we have Candida being the commonest fungal infection. So how do we tackle this problem? Now that we know that hospital-acquired infections is a real threat to the hospitals, how do we handle them? That is by constituting what is called as the Hospital Infection Control Committee. So every hospital should have a hospital infection control program which will address this problem and deal with it. So usually the chairperson of this committee is the head of the institution. It could be the medical superintendent or the director of the hospital or CEO or whoever the authority is. And the member secretary should preferably include a microbiologist, and other members should include the heads of all the clinical departments. And we should not forget here the role of the public health nurse. So the nursing superintendent of the hospital is again usually a part of the infection control committee. So this is how the committee is constituted, and they have to meet at least once a month or once in 3 months at least. It depends from hospital to hospital, and their functions include surveillance of hospital-acquired infections within their hospital, investigation of outbreaks, and institution of control measures. So that's the role of the Hospital Infection Control Committee. And then they formulate policies like the antibiotic policies and waste management policies, everything with respect to their institution and what would work for their institution. Now, having talked about the Infection Control Committee, which is so important in every hospital, how will the committee go about carrying these functions? That is by the standard precautions. So here I'd like to define the standard precautions for you. These are precautions that are consistently used for all patients, regardless of their blood-borne infection status, because you do not know most of the times whether the patient is asymptomatic with HIV, hepatitis B or C infections. And these precautions should include proper sterilization and disinfection practices and safe disposal of biomedical waste. So these precautions have to be taken for all patients, not only the patients who are infective. We shouldn't say that because this person is HIV positive or hepatitis B positive, therefore I'll put on my gloves and take the precautions for this person. And if another person comes and we don't know the HIV status or the hepatitis B status, we may be at risk. So these precautions are laid down universally. That's why they were earlier termed as universal precautions. That means you have to take these precautions no matter what kind of patient you are treating or handling. And this holds good for all the healthcare workers working in a healthcare setup. So what are the rules of the standard precautions? They include the following areas. Firstly, hand washing, then the use of barrier precautions like gloves, aprons, the masks, caps, boots, etc. We'll go on to this a little later. And collection of laboratory specimens. Here again standard precautions should be in place. And handling spills, patient placement, transport of patients as well as transport of biomedical waste, then sterilization and disinfection practices, then waste management, and immunization of healthcare workers. So all these points are encompassed in the standard precautions. So what are the basic requirements here? Protective clothing, hand washing materials, the disinfectants, sterile equipment, use of sterile equipment, and most importantly a motivated staff. Because if you have all the all requirements for a good infection control program in the hospital, if everything is in place, the program will still fail if you don't have a motivated staff. So that is one of the most important things, to have a staff that is well trained, well motivated to carry out all the standard precautions in order to prevent these hospital acquired infections. So what are the protective clothing items that are in use? Apart from gloves, we have the facial protection masks, the protective eyewears when splashing or spraying of blood and body fluids is expected, for example in the labor rooms. And these have to be washed if contaminated. Surgical masks are not really adequate for airborne route. Like Mycobacterium tuberculosis, it's not enough to just use the ordinary gauze masks or surgical masks. So one has to use what are called as the N95 respirators, or even the HEPA respirators, that is high efficiency particulate air respirators, which are said to filter off 95% of organisms. And occlusive bandage, that is all skin defects, should be covered with waterproof dressing like Band-Aid or bandages which are waterproof. Now the color-coded containers that should be used in a hospital setup, these are the universal colors that are usually used. For general waste or non-infectious waste, we have the black bags or the black containers, and for syringes, cannulas, catheters and other plastics which are infectious, the red bags. The yellow bags are used for infectious, pathological and anatomical waste, while the blue bags or the blue containers are used for whole and broken glass or for sharps. But remember here, the sharps have to be put first in a puncture-proof container. That is the sharps container which is stiff, either cardboard or thermocol or something, which is resistant, where the sharps will not jut out and prick the person who's handling the waste, the bags. So here I must also mention that although the red bags are mentioned here, many of the institutions, at least in Delhi and thereabouts, they prefer not to use the red bags, because the red bags cannot be incinerated, and if they are incinerated, because of the cadmium content, the pollutant gases are emitted, which is against the rules of the Central Pollution Control Board. So some hospitals have done away with the red bags. But remember, even if you use the red bags, they should not be sent to the incinerator. They can be disposed of, they can be used for, if you are using microwave, autoclaving or any of the other techniques, it's okay, but they should not be incinerated. Now coming to the healthcare facility areas, this is the subject proper for today. The various areas in the healthcare setup where waste is generated and where precautions have to be taken are the operation theatres, the wards, laboratories, blood banks, the intensive care units, the labour rooms, casualty and emergency rooms, the mortuaries and nurseries. In the operation theatres, what are the precautions? Of course, we know about hand washing, which is very important. There are different kinds of hand washing. Here I must mention the types of hand washing. You have what is called as the social hand washing, which is just washing with soap and water for about 10 to 15 seconds. This is what we do before eating food or after visiting the toilet. This is called social hand washing. And then you have the hygienic hand washing, where before doing a procedure, minor procedures like in the labor rooms or in the minor OTs, the hygienic hand wash refers to hand washing that is done for maybe a minute or so, and where care is taken to include all the parts of the palm and the wrist. And the third type of hand washing is the surgical hand wash, the surgical scrub, what they call. Here the hand washing is done elaborately for a good 3 to 5 minutes, and it has to be, the hands have to be washed up to the elbow region. This is before conducting any operative procedures in the operation theatres. Then of course the use of gloves to supplement and not replace hand washing. So the use of gloves should not make one complacent that hand washing is not necessary. And then the use of personal protective equipment. This includes masks, gowns, aprons, goggles, boots, etc. And parenteral and invasive procedures where precaution has to be taken while carrying out these procedures. And of course staff training and waste management. So even within the operation theatres, the staff that is working in the in the operation theatres, be it the operating room attendant, the nurse, the surgeon, the anesthetist, whoever it may be, they have all got to be trained in waste management procedures. That is, and the containers, the black containers with the black liners, the yellow liners, and they all have to be kept in the operation theatres, and every person, every staff member should be educated on what kind of waste would go into what color coded container. So this is segregation at the point of generation, and this is the key to any waste management practice.
Can I just ask a question here?
Yeah.
In your hospital in Safdarjung, what is the precaution that you take when, especially in the operation theatre, as you're saying? My experience has shown that the surgeons are really careless when it comes to waste management.
Actually, yeah, this is where you know what I mentioned about a motivated staff. That's very important here. In fact, now things are not so bad, because I have seen now we have this regular periodic ongoing training programs where we you know periodically keep telling everybody that surgeons also, like, because at the junior level especially we have these training programs for all the residents and interns, and at even the Safai Karamcharis, the nurses. On different days we have what is called as the infection prevention week, so where they are all trained. So I think it has made a difference, because at least everybody is now aware of the color coded bags and what items should go where. But of course in a bit of a hurry or something, if occasionally it's not going into the right bags, that again requires a lot of motivation again.
What I've seen that the surgeons hardly do anything, and later on the Safai Karamcharis are actually segregating it within the operation theatres.
Yeah, maybe they may not be putting it into the bags as such, but when it is kept, the operating room attendant,
and
sometimes they pick it up and...
any special precaution with the sharps waste from the operation theatres? Or
yeah, the sharps waste, at every point, at all places, the puncture-proof containers are kept at very appropriate places, because nobody should be made to walk a distance to go and throw it in a puncture-proof container.
Destroyer later
Yeah,
on?
we have the needle cutters and destroyers at all points, and even at the laboratory collection centers everywhere. And as far as the OTs are concerned, the puncture-proof containers are there, because the anesthetists are all the time using these needles, and when they're giving in the IV fluids, starting up the fluids and giving injections to the patients. So the puncture-proof containers are kept at a very sort of a reachable kind of a distance, so that nobody walks around, or because then they get to be a little complacent or feel that okay, this can be discarded later, and they just keep it aside. So it has to be kept in a place where they can immediately drop it into it. That is important. So now coming to after operation theatres, let us see what is required in the wards. Now, use of only sterile instruments and material, that should be imperative, and one has to disinfect all the materials and instruments before disposal. This is very important. And segregation should be in color-coded bags or containers which are covered. And clean and wash the waste bins regularly. Do not store the waste beyond 48 hours. Staff training on waste management again. So yet again the stress is on training the staff. Disposal and disinfection. Here in the picture you can see the containers that are kept for the disposal of waste. But the problem here, there is something wrong with this picture, in the sense the tub that is shown at the bottom, it is not kept covered, it's kept open, and this should not be the case, because the hypochlorite that is being put in it, it does not stay in the uncovered state. It's hardly effective. So after an hour or so, it's only plain water we are putting all the waste into. So keeping it covered is very important. And here we see the disposal and disinfection that's being done by, we have the blue bucket, which is an outer container, and a perforated orange colored bucket that you can see here. So once the waste is dipped into it, that is in the hypochlorite solution, so after the required period of time, that is about half an hour or so, the inner container is just lifted off, and that's how it is drained, and the waste that is collected in that is disposed of. And in the second container, again you can see that within the tub, within the white bucket, they have again the perforated container. So coming to laboratories. Laboratories again are very important, because here again the chance of infection transmission is very high. So one should have a restricted entry, and the biohazard symbol has to be put up, or maybe outside the door, with a no admission board again. And the workers in the laboratory, that is the staff in the laboratory, have to wear the laboratory coat, gloves, and other personal protective equipment like masks and caps wherever required. And they should clean the laboratory work surfaces periodically, and recapping of needles should not be allowed. A little more on this later. Here is the biohazard symbol, which is universally accepted. This is the symbol that's accepted all over the world. So anywhere you see this symbol being put, it means biohazardous material is being handled, and one has to be careful about the biohazardous material. Now coming to laboratories again, good emergency procedures have to be followed and instituted. There should be adequate training of the staff, and there should be the use of biosafety cabinets wherever necessary. And avoid risk of aerosols by use of personal protective equipment, as mentioned earlier. Effective hand washing, safe transport of specimens and instruments, safe disposal of infected waste and sharps, and avoid risky procedures like mouth pipetting, eating in the laboratory, or eating on the work surfaces where infective material has been handled. So these are important points to take note of in the laboratories. Now continuing with the laboratory scene, the sample collection. Sample collection is an important activity where gloves have to be used and disposable syringes must be used, and ethyl alcohol or isopropyl alcohol should be used for disinfecting, and puncture-proof containers with disinfectant should always be kept by the side of the person who is collecting the samples. And leak-proof screw-capped containers should be given to the patients for collecting samples, whatever the sample would be. And labeling of the specimens should be done, and this should be without soiling the request forms. Very often we find that the sample is collected in a bottle and in a penicillin vial or a small vials. The sample may be a blood sample or a urine sample, stool sample, whatever it may be, and it is kept on the request form or the requisition slip of the patient. It's just kept on that, probably for identification or whatever. And sometimes it so happens that the samples can overflow and the requisition form is also fully stained. So this should not occur. And decontaminate all the contaminated material by autoclaving. So if the autoclave is not available, then other methods can be used like microwaving, or the infectious material that is in the yellow bags, those that are put into the yellow bags can straight away be sent to the incinerators. Biosafety precautions for lab workers include wear gloves when handling infectious material or where there is a possibility of exposure to blood or other body fluids. All laboratories that work with material that is potentially infected, they require a generous supply of good quality gloves. Discard the gloves whenever they are thought to have become contaminated or perforated, and wash your hands and put on new gloves. Do not leave the workplace or walk around the laboratory while wearing gloves. Here, we commonly see pictures of people who wear gloves and they think that, once they wear gloves, they are safe. And they just walk around handling their mobile phones, the telephones in the department, the door handles. So all this should be taken care of, because in a laboratory, we are handling infectious material. And a person should not remain complacent that once the gloves are put on, anything can be touched.
So, can I just interrupt, because when you talked about mobile phones, recently there was an article in the newspaper saying that mobile phones are actually transmitting infections.
A lot of infections, yes.
So, yeah, so there should be, are there some standard precautions that are there that they should not be using them?
Not only mobile phone, in fact the keyboard also, like computer keyboard
Yes.
they're using, that is
Yeah.
also one source of infection.
In fact, I read an article recently where they have mentioned about ladies' handbags and purses.
Yeah.
So ladies' purses are known to be kept here and there everywhere. So people say that even those should have restrictions on them to carry the purses in and out of laboratories and places of where hazardous material is being handled. But as far as mobile phones and touching phones and all is concerned, there are no hard and fast laid down rules on these yet. Although I hope it comes about
Because
sometime
it's already-
soon,
yeah,
because it is
close.
required. There is no rule laid down, but one has to, conscientiously try to follow these things, because they know that infection can spread in these ways. So we have to constantly motivate the staff again to follow these precautions.
Maybe in
although
your
there are
training
no really-
programs you could just
Yeah,
emphasize
in
more
training
on
program.
that.
In fact, now in this IGNOU certificate in healthcare waste management programs, where we conduct the contact sessions, we mention all these points, saying that these are the the mobile phones coming into our lives has brought with it some fresh problems. So we have to deal with that. So we do tell them about keeping it away and not handling it once you are wearing the gloves and handling material.
Because it goes
So-
everywhere in the operation theatre, everywhere the
Yeah,
mobile
so
phone is
some
there.
of us, some of the doctors I've seen, they even use some spirit swab or something to
To
clean
clean,
the
okay,
mobiles,
okay.
just as they clean the surfaces of their stethoscopes, the diaphragm of the stethoscopes.
Okay.
So
Yeah, that could be
something
very
like that
good.
could
That
be
is
done.
very
Yeah,
important.
that is yeah.
So, to continue with biosafety precautions for laboratory workers, wash hands with soap and water immediately after any contamination and after work is finished. If gloves are worn, wash your hands with soap and water after removing the gloves. Wear laboratory gown or uniform when in the laboratory. Wraparound gowns are preferable because they are easy to put on and remove. And remove the protective clothing before leaving the laboratory. When you're working with material that is potentially infected, say with hepatitis B virus or HIV, then close the laboratory door and restrict access to the laboratory. Other precautions include to keep the laboratory clean, neat and free from extraneous materials and equipment, and disinfect the work surfaces when procedures are completed and at the end of each working day. An effective all-purpose disinfectant that's used in the hospitals is sodium hypochlorite solution. 1% sodium hypochlorite is more than enough, because it has been found that 1% sodium hypochlorite is sufficient to destroy organisms like HIV, hepatitis B and all the other organisms that we generally fear in the hospital setup. Which are causative organisms of healthcare associated infections. And whenever possible, avoid using needles and other sharp instruments. So if possible, avoid using the needles. But if it's not possible to avoid and you have to use the needles, then the used needles, syringes and other sharp instruments and objects have to be discarded in puncture-proof containers. And do not recap used needles. Do not remove needles from syringes for disposal. Now, with that we cover some of the precautions that have to be taken to avoid laboratory infections. Now moving on to the next important part of the hospital, that is the mortuaries. Here dead bodies are being handled every day, and infectious precautions have to be taken here also. Dead bodies should be handled carefully, and all persons handling the bodies should wear aprons and gloves. For post-mortem and embalming, rubber gloves and aprons are generally adequate with plastic aprons. And in case of invasive procedures like evisceration or cutting bones or tissues, examination or dressing, wherever splashing of blood is expected, mask, goggles and rubber boots must be worn. To notice, since we are handling a large quantity of blood, that is, a unit of blood is something like about 350 ml of blood. So large quantities, if this blood is infected, the chance of infection transmission is quite high. So the precautions that have to be taken in dealing with these blood bags and blood samples in the blood bank is very important.
Ma'am, regarding this blood bank, this is my common observation, like whenever I went AIMS for donation of blood. The person who is putting me needle on my veins, he is not wearing gloves. Is it the standard method, or he also should wear the gloves?
That again, some institutions prefer not to wear the gloves, because every time from patient to patient he'll have to keep changing it, or they may be handling other things, the pen and telephone and the doors.
So what is the recommendation?
So the recommendation is you have what is called as these hand rub solutions. Probably that could be one of the, although even in our hospital it hasn't yet universally been accepted. I mean, they are not still using it, but that is one option where you have the hand rub solutions, which are alcoholic hand rubs, where you don't really have to go and wash with soap and water. You don't need water to be there to wash and clean your hands. So after every procedure, in fact we say this even in the wards, from one bed to another, you examine one patient during your rounds and then go on to the next patient. You're supposed to use a hand rub. In some of the private hospitals, I have seen the sterilium bottle, which is kept at the, along with every bed. So you just have to, it's those you dispense a little bit and then rub it this way, and it just evaporates. It's an alcoholic hand rub where you don't need water. So you don't have to walk up to the wash basin and actually wash with soap and water. So even places where running water may not be available, if you use these hand rubs, I think that's a good thing to do. The hand rubs are a good solution.
Areas like blood banks and all, I think so it's important.
Yeah, so the hand rub solutions are, I mean, that could be a solution to this problem. And now coming to safety measures for the waste handlers. A baseline serum sample of the waste handler should preferably be stored. Protective clothing and gear have to be worn by them, that is the personal protective equipment like gloves, apron, masks, caps, boots. And of course hand washing is very important even for the waste handlers. And they have to be trained how to handle sharps handling, spills handling, accident reporting and first aid measures, transportation, post-exposure prophylaxis. They have to know that if there is an accident like a needle stick injury, they have to know what to do. The post-exposure prophylaxis should be in place in every hospital, and of course awareness and training. So the sequence of protective gears for waste handlers is preferably in this order. Wash the hands, wear thin set of clothes. This is again this is optional, of course. Wear boots and shoe covers first, and then wash the hands again. Wear a cap, then the mask and waterproof apron, above which the gown can be worn, and protective goggles wherever necessary, and wash the hands finally, dry them and then wear the gloves. So the gloves are worn last. And one should not use single-use items. There should not be reuse of single-use items. So these are some of the important points for all waste handlers. With that, we come to the end of the precautions that have to be taken in various various areas of healthcare facility. But now some of the common points to be noted regarding some of the infection control procedures. I would just like to ask here if there is insufficient time, or we have to.
We can carry forward also.
So
we can also carry forward.
If it's a new topic, maybe we can start.
Maybe we could cover the sharps
later on. We can have a discussion. No
later on. Right now, because we are having still 4 minutes. 3 minutes.
So we can just,
So,
I think
while,
I can't
going
do that.
back to your previous slide, when you said this should be the way you should wear them, the method of removal is first gloves.
Yeah, it
It
should be the other way.
backward
Yes.
facing,
Backward.
yeah.
Yeah.
Because that's generally there, they're
So-
getting confused with
And
that.
even while removing, we should, there are, in fact, this should ideally be shown in the form of a video or something, because when you remove the gloves, they have to, one should not touch the surfaces where possible
It should be
infection is
inside
there.
outside.
So inside out, and then this glove, after it's removed, it's kept into the other glove, in the palm of the other glove. You hold it, and then you remove the other one. So at no point of time you come in contact with the infective surfaces. So also the aprons, they have to be taken out from the side like this and immediately bundled in front, so that your hands don't touch the front of it. So these are all, there are ways of doing it, and one has to religiously do it in order to, so that it becomes a kind of a reflex, and you will always be removing your gloves and gowns in the same manner.
Once you're removing them, there are practices where, so that they're not being reused, to generally puncture the gloves or cut
Gloves,
them.
yes, especially the single-use gloves.
Single-use.
Of course, for the rubber gloves and all, we don't do that because they are reusable. I mean,
They could
wash it
sterilize
and-
them in this.
But the ones which are single-use gloves, you have to discourage people from reusing, because in a country like ours, I mean, developing country where, with poverty and ignorance, more than poverty, I think it's ignorance, that people tend to feel that it can be reused, it looks clean, and that kind of
Yeah,
attitude.
this is the main
So you have
attitude.
to make sure that, it's cut or something like that. Similarly for needles also, we destroy the needle tip so that they are not reused.
But they generally just punctured and just thrown in
No,
the
it's
OTC
thrown
bin.
into the disinfectant.
Disinfectant.
It's disinfected, or if they have facility, if
So, but, okay, they
if you have
removing it
facility for
inside,
autoclaving or
outside.
microwaving, you do that, and then it's sent off. Shredding can be done.
I think in these sessions we'll end up here. Thank you, Dr. Sumati. In these sessions, basically, we have discussed what is the nosocomial infection, what is community acquired infection, and like blood-borne, different type of blood-borne risks of like hepatitis B and HIV virus diseases, and different area where different area of the hospital where different type of special precaution is required. That is very well explained by Dr. Sumati, and I think all of you will be benefited too very much. And few of the things is still left behind because time is short. In our next sessions, we will cover up some of the issue which is Dr. Sumati is going to be discuss with you. And here we will end up the session, and we will meet again after 15 minutes break. And thank you very much to all of you.
Thank you.